Hi, Laura. Thank you so much for coming on the podcast again. How are you?
I'm well, thanks. Thanks for having me again.
Yes, I should have looked at what episode we were talking about. I know we talked about liver, right? Last time we chatted.
Yes, liver, detox, all that good stuff.
Awesome. So I know on your Instagram stories you've been talking about acne and like skin lately, and I know a lot of people struggle with this. So I wanted to have you on. But before we get started, go ahead and introduce yourself, who you are, and what you do.
Well, my name is Dr. Laura Belus. I'm a naturopathic doctor here in Toronto, Canada. I specialize in female hormones, healthy skin, and natural weight maintenance and healthy weight body composition. So I'm really happy to take the natural approach to health and make it easy and simple for people to get where they want to get with their overall wellness.
Yes, for sure. So can you kind of give us the basics on acne? Because I know like we think, we always think of it being on our skin, right? And it is, but we'll go into deeper, but like, what are pimples? Like, why do they happen? What are they?
What exactly are they? Yeah.
I mean, ugly.
I know, and I have one right now actually. So I'm like, oh, we can't. No one can escape it. No one can escape it. But pretty much pimples, or the sort of more scientific name, which we would refer to as papules. There's different types of pimples that can happen on the skin, and some people listening right now would notice that there's what we call whiteheads or blackheads, so darkened spots or whitish sort of bumps in the skin, or the traditional pimple, that red sort of angry looking dot. And then we have more cystic acne, which is, again, deeper into the skin and definitely painful to touch, and you can tell it goes deeper in the skin. Well, at the end of the day, they actually are sort of different variations of the same thing. And what that is a congested pore of your skin, in your sort of your skin cell, or in your between skin cells, where acne can sort of grow because of three issues. Acne bacteria, that's just the actual name of the bacteria, which is why acne got its name. Too much oil production, so a clogged pore. And what we have is, unfortunately, slower skin cell turnover, or dead skin that sits on the surface, which can build up. So this is where the different variations of acne come from. Some people will get a whitehead or a bump, but no redness. There's no infection. There's no inflammation, but there's still a clogged pore. Other people will have deeper cystic acne, those really painful bumps, and those are due to a deeper blockage and a lot more of the bacteria at a deeper level, where unfortunately the problems start. So it kind of gives you an idea of what's going on, but those three main factors are what causes some variation of a pimple to get started in the first place.
And then it's everywhere, right? Because I know people struggle with acne like on their chest and on their backs, and just not their face, but
no. And unfortunately, the reason for those types of acne, or those locations of acne, it is not just a simple reason, but a lot of times it is hormonal. Our back is very much prone to sensitivity of testosterone, which is one type of hormone. There's a lot more oil production on the back. The chest can be a lot of other things. So food, sometimes detox, needing a detox rather. The skin is very thin on the chest, so having acne on the chest is also hard to treat sometimes, because it's not as resilient as our back, which we can sort of scrub and throw stuff on to treat the acne. So the cause of the acne on our chest or back is usually hormonal, but it is as frustrating as on the face.
Right. And it's nice to know that you have, like, even I get pimples, like especially around like my period time, I get one or two that like to pop up. But sometimes, we take care of ourselves so well, but like we still can, get them. They're not always just forever gone.
Absolutely not. So, and a lot of people are getting them later in life. So just because you're not 13 or 15 anymore, it doesn't mean that an acne breakout or the odd pimple can happen. But I think a lot of people are just looking for, what is my skin like the majority of the time? I want it to be clear majority of the time. So accepting that that's possible is really important, because it is.
Yeah. And are there certain people that are more just prone to acne?
Yes. So genetically, there are definitely some connections. We sort of seen in the research now, certain cultures, certain parts of the world have different oily levels of their skin. So they have different hormonal pathways. And remember, where there's more oil prone, there is definitely more risk for acne. So definitely there are certain parts of the world that are more likely to get that. So certain parts of Asia, for example, certain types of Inuit populations are actually less likely to have acne, even though they have a high-fat diet. So there's a lot of stuff that comes up, but let's just call it that the hormones are the fire that puts itself under people's skin, and the hormones can kind of set everything off in a negative direction.
Yeah. And so of course with acne and any skincare, we want to wash our face and do topical regimens. So is that the most, I know we'll talk a little bit more about deeper into like gut health and acne, but is that the most important aspect of, you know, preventing or just making sure we don't get acne? And then give us some of your favorite products if you do have some.
Yeah, so a topical, you know, I like to sort of treat acne from the outside in. And I know that kind of sounds a little bit, wait a minute, inside out, right? No, outside in the sense that what you put on your skin is really important because it can help slow down that worsening of acne, and it can speed healing if you're doing the internal work correctly. Mm-hmm. So when it comes to topical cleansing routines, I always recommend, and every patient is different, but I always recommend that people are at least cleaning their face properly. And what that means is if you're wearing anything to cover up the acne, I've been there, 3 types of concealer and your foundation and everything else, you know, you can't just quickly rinse off with an oil-free cleanser and expect your skin to start to breathe and, you know, naturally regulate itself. So cleansing is very important. Now, I tend to opt for a double cleanse. And with a gentle cleanser, I always think it's important to remove anything off of our face first. In the morning, you can do with a single cleanse, but a lot of people were just quickly rubbing and rinsing off. And that can really make that clogged pore and that congestion worse. So I don't recommend typically an oil-free cleanser unless you have really deep cystic acne. A lot of people are afraid of oil, as long as there's not a lot of parabens or silicones and a lot of heavy mineral oils that can clog pores. Having oil, for example, that is contained in a cleanser to help remove makeup, for example, is a really great way to actually emulsify and get that stuff off your face before you reset.
Okay. Is there a favorite oil that you use?
Well, so there's a Toronto skincare company called Robi Skincare, ROBI, that I love. But there's a lot of oil products out there that are literally just a mix of, if it's rosehip oil, coconut oil, jojoba oil, and they just emulsify the makeup. Now, I don't feel, honestly, that the oil I can't cleanse my skin with just oil. I need to have something to kind of feel clean. So I'm really loving this brand right now. You may have seen it on my Instagram, AMG Naturally. So Age More Gracefully, and it's a US company that's a medical grade skincare, but it's completely plant-based. So I get the oils from, you know, papaya and fruit acids to help break down and emulsify my dead skin. It's almost like a natural dissolver on my skin without the typical stuff that we're all used to using, like benzoyl peroxide and salicylic acid, which are really drying. So when I cleanse my face, and I tell patients this too, if you feel your skin's tight, super clean, like it just feels like there's no movement and there's no natural elasticity left, then you've most likely stripped your skin. And automatically your skin goes right to oil producing mode. So you really got to be careful with the cleanser you use. It can't be too drying. Even if you apply a moisturizer right after, it's really important to cleanse naturally.
Nice. And so what are your thoughts about just using just coconut oil or, you know, something that you have in the kitchen?
Yeah, I absolutely love, you know, depending on your lifestyle, I find that if you're using like a device, those Foreo devices, or even like a silicone exfoliating little mitt, that can help the oil penetrate a little bit deeper. Using our pads of our hand with an oil, with a standard oil like olive oil, coconut oil, they're hard to penetrate. It's a great way to remove makeup, which I do when I'm on the go. But I find that it's hard for people that have congested skin to lift those dead skin cells out. What the oil cleansers do a great job of is breaking up the extra oil. But remember, there's 3 issues with acne. It's the oil, it's the congested skin. It's the oil, it's the congested skin, and it's the bacteria. So those 3 issues all have to be considered. And the coconut oil only just does the first one, which is removing that excess oil.
Right. Yeah, I use, what are your thoughts on I know they're super popular and they're the, I don't even know what they're called. But they have the brush and then it rotates and you.
Oh yeah. Like the Sonicare, there's different varieties. Yeah. So those are great too. Don't overuse them. Again, I've been there. I know what it's like to have acne. We tend to over clean, and no issue with that. But remember, most of the time, if our skin's red and inflamed and if there's acne, it's already under stress. So a physical clean is important, but that extra brushing, maybe at most once, if not twice, at very, very maximum per week if you have regular acne flare-ups. You just want to give the skin a chance to renew its own oil production and to calm down that redness on its own, which of course helps with products, but we just want to over clean. I just feel like people think acne equals dirty skin, and it's absolutely not true.
Yes. And I think that's an obsession of just like, that's why I asked with topical practices, people that have acne are just constantly wanting to clean their skin because they think it's like always surface level.
Yes.
Type of issues. So going into that, how does acne tie into gut health? And, I know it's a loaded question, but.
It's very much related to gut health. There's two buckets that I like to sort of put acne sufferers into. And I know this is oversimplifying, but just to give people a general idea. Congested skin or just overall acne that's not very angry looking is typically more of a liver issue. So it's a liver detox issue. And then gut health is the bigger bucket that a lot of people don't want to investigate, or they're not sure where to start, or they think it could be related to their gut. And it's not always a food that they're eating. So people say, well, I gave up dairy. It's not my gut. It's not food. That's actually not the only thing. That's just the surface level of worsening the problem. When I say if it's a gut health issue, I mean it's usually a gut imbalance issue. So bacteria, history of antibiotics, birth control pill, infections when you were younger, travel, a lot of things can go wrong to mess up our guts. And then our digestive system does show up, unfortunately, in our skin.
Right. And so what was the first bucket that you said?
Liver health. So detoxing is a really great way. I actually start all of my patients, if they have acne, on some sort of basic liver detox. And what I mean is not a cleanse, right? It's just some liver support, antioxidants, whether that's a protein powder that has a lot of extra minerals and vitamins, plus a few additional supplements, things like fish oil, extra vitamin C, antioxidants. That liver detox shouldn't take more than 3 or 4 weeks. And once we clean the liver out, then a lot of people's skin has improved. Then we know, okay, if your skin is not completely resolved, your acne has not resolved, then we definitely want to look deeper into the gut. I just feel we need to get the liver working well, because that's where all the junk gets, cleaned out from. If we've cleaned out the liver and that's running smoothly, and let's say you have a 25 or 30% reduction in your acne, great. Well, now we know we can really hone in on the gut. The gut can be a troublesome one to treat. I really recommend people don't DIY it. They should really either work with a nutritionist or a functional medicine doctor or naturopath, because it's very stubborn. So people can get clear skin, but then the same problems come back. So treating it once and for all is very important if you can work with someone who knows how to deal with the gut and acne.
Yeah, I think that's a great example too, of just like also candida, like, people want to jump into gut health, but part of the whole detoxing process is making sure our liver is working properly so we can get rid of things that we're trying to get rid of.
Yes.
The liver. And then tell me some of your favorite supplements. I know you mentioned a little bit about with liver detox and stuff, but supplements maybe like specifically for acne.
Yeah. So people will run to two specifically that I don't always use in my practice: vitamin A and zinc. Vitamin A can be very toxic if you're thinking about becoming pregnant or you're wanting to maximize your fertility. I do not recommend going on vitamin A. You need a high dose for it to be effective. And it can be very effective, but it does dry out the skin a lot. It's like the natural version of Accutane, which most people know is that strong medication for acne. So the same, they come from the same molecule. So vitamin A can be very effective. It's just not a first line treatment. And if you are seeing someone, then talk to that practitioner about maybe considering vitamin A. But zinc is one that also gets a lot of positive responses. It is useful, but it's mainly an antibacterial and a testosterone support. So if you have chest and back acne, I find it very helpful. If you, again, have a lot of the hormonal pattern of acne, it can be helpful. If you try it for 2 months, I say give it 2 months. Try zinc for a couple of months, and if it doesn't help your acne, it's probably not going to. Zinc for long term at a high dose should not be used. So I always tell patients, if you've been trying this for 3 months consistently and you haven't noticed a difference, awesome, great, let's move on to something else. So the things that I do love for acne: high dose omega-3 fish oil, specifically high in EPA. EPA is the one type of omega-3. There's always EPA and DHA listed on the bottle. So you want to make sure that it's a high dose EPA. Looking at between 2,000 and 3,000 milligrams a day is what I like. I tell patients omega-3s are not a overnight strategy, but they can be an awesome long-term strategy. So give it a couple of months, and I find this keeps inflammation, redness down, and prevents new lesions, as well as can help prevent scarring. So a lot of people say, great, my skin's clearing up and now I have all these darkened spots and my skin's just really uneven. Well, that's great if your acne's gone, but not if you have a new problem. So having that anti-inflammatory support from a high dose omega can be very useful. And then last but not least, when it comes to acne, I'm just thinking the top ones that I like to use. I talk a lot about EGCG or green tea extract. It's the potent type of antioxidant in green tea. I tend to blend that with a little bit of vitamin C. So high dose, right? So 500 milligrams of EGCG and about 2,000 to 3,000 milligrams of vitamin C. Again, vitamin C is awesome for new collagen and darkened spots. So a lot of women say, and men say they like it because it's tasty, it's easy to do, and you can actually see some pretty quick results to help your liver and your gut protocol. So this is just in addition to that.
Yes. Yeah, so with spots after the pimples, because that's a total issue, because yeah, you get excited. Like I don't have acne, even I have like, where it could still like look like I have acne, but it's just old scarring. I am a total pimple popper. I will admit it is so hard for me to not pop it.
Yes. But you don't have to pop the pimples for the acne scars to happen, right? It could just be slower skin healing. I do recommend, so from a topical perspective, I like any resurfacing treatment. So low dose retinol, like 0.5% of retinol is really great for like overall anti-aging, but it's also great to help resurface your skin if you have any darkened pigments, as well as glycolic acid. So sounds intense, but glycolic acid, if you buy it from a good reputable skincare brand, it really helps to resurface and renew skin cells. So remember, pigment is just deeper levels of your skin. It's like having certain parts of your skin get a bit of a tan, right? That melanin, that darkened pigment is deeper within your skin. So it's not a thing you can exfoliate off. What you want to encourage is new skin turnover. So again, what you're doing inside really helps. So how quickly your skin turns over has a huge connection with how well your overall body is doing in terms of metabolism. So I ask patients, how's your hair and nail doing? If they're doing well, if they're thriving and growing and turning over very quickly, then most likely you're going to have the same response with your skin. So again, they go hand in hand. I just tell people, take a look at how your overall health is. And if you feel that sluggish or slow, then we may need some extra support for new skin cell turnover. And sometimes that's topical stuff to help things along.
Awesome. Have you used Beauty Counter? I know Beauty Counter just came out with like a resurfacing peel, and I've tried it and it's pretty amazing.
It's pretty good.
I remember feeling like a difference in like 3 days, which I have never had that with skincare. Like it's usually like you just got to consistently use it and you see improvements, but that was a pretty game changer in the beauty world. I know.
Yeah. Beauty Counter I know has a lot of great products, and so depending on what's in the peel, it could be like fruit acids like AHA, things like that. And those are great too. Those are a little bit more gentle on the skin. And like most people will probably know themselves, the T-zone, it can be a little bit more aggressive. 2 or 3 times a week, you could do a resurfacing peel. Your cheeks, again, that's where acne scars tend to like to build up. You really do got to be gentle. I recommend in those cases, like PRP, which is like a more physical injectable treatment for scarring. And that's an investment. But if you're finding the scars and the pigments really deep on the cheeks, don't make things worse, right? Don't try and overdo it. Really listen to your skin. And if you have extra sensitive skin, the fruit acid peels are probably a great way to start. Be consistent. And then if it doesn't really start to see a difference in 2 or 3 months, then you may want to go see like a skincare esthetician or a specialist to help with some sort of physical treatment.
Yeah. And so is there anything else that we haven't talked about? Like hormone, I know we talked a little bit about hormones, how that plays a role in acne.
Yeah. And we sort of did touch on that, but let me sort of just recap. And I think people say, well, it's my hormones. Acne is caused by my hormones. And it can be, especially that jaw chin line acne. But when we talk about treatment, I like to go to the root cause. So let's start with the liver, which cleans out excess hormones. So automatically we're managing our hormones well. There's an awesome supplement if you have excess estrogen causing your breakouts. It's called DIM, D-I-M. It comes from broccoli, but it's the potent extract. So very, very useful for extra estrogen. But I can't tell you enough at how many patients they come in saying, it's my hormones, it fits a hormonal pattern, but we test their hormones and they're not that out of whack. It's not always estrogen, though estrogen can be out of balance. It's well, is your liver functioning well? Maybe it's not clearing out the small amount of estrogen that you do have. Maybe it's not helping to create new progesterone if you're not eating enough healthy fats, or you're overly stressed, right? Your hormones get out of whack, and that's when we tend to blame estrogen, for example, but it may not be an overproduction. It just may not be an overall balance. So getting some of those answers with testing, I think I mentioned that on the last time I was on the podcast, so important, especially if you've tried to detox and it hasn't helped. So starting with a detox is probably the best way to just foolproof it and see how much better do I feel? How much better does my skin look? And then if you feel your gut is not in balance, even if it's the slightest like inkling, a lot of us know our bodies and we're like, yeah, I know like my gut probably needs some work. Then you definitely want to see someone to focus on that. But the hormones get covered with the gut and the liver. They definitely get covered because those are the two ways that we metabolize those extra hormones anyways.
Yeah. I know you use the Dutch, right?
Yes. Yeah.
I love the Dutch. And so I did mine. And so my testosterone was fine. It was in normal, but I did favor a little bit more in the alpha pathway.
Okay. Yeah. But again, great to see those results, to see, am I blaming testosterone, right? Am I blaming a lot of women with PCOS or other conditions? A lot of times not seeing their values leaves you in the dark. And I've been there with skin and you're like, nothing's working. Well, we kind of need to know what the problem is first, because there is a solution. We don't want to all test and spend hundreds and hundreds of dollars on testing. I get that. It may not be feasible for us, but it does empower you to say, now I know what's out of balance. Now I know the fast track to correct it.
Yeah, I know. I get a lot of people that aren't ready to spend, and most of the tests like aren't covered by insurance. So you do got to pay a couple $100 and it gives you the answers that I feel like you need. And so to me, it's like totally worth it. I'm a total lab rat though. I'll take every
same.
What's going on? Like you can't really see everything. So awesome. I wrote down some good notes to share with our listeners. So go ahead and let us know where we can find you.
Yes, so you can find me online. Instagram is where I hang out the most, so at Dr. Laura Belus, or my website where I put lots of blogs. And I encourage people, if they're considering a detox, to try and download my free 3-day mini detox at drlaurabellis.com.
Awesome. Thank you so much.
I'm so happy to be on again, and I look forward to sharing this with my listeners as well.
Yeah.